In amongst the increasing rigours and pressures of modern dentistry and balancing that with a life away from the workplace, how do you make time to embark on continuing education? And from the wide-ranging methods that are now available, how do you decide which combination of those is right for you? For many, the principle of lifelong learning has become an important part of implementing both personal and business development plans. But in what way do you learn best? Do you really know where you're heading and how you're going to get there? For the last 3 years, Dental TV has been developing an education and training resource for the entire dental team. With a blend of clinical, academic, political and business material, laced with news and views, these verifiable programs are brought to you on video, DVD or CD. They can be watched in the workplace or even in the comfort of your own home, individually or as a group, and genuinely at a time that suits you. This educational format is easy, entertaining, flexible, tax efficient and relaxing, providing a host of ideas that will enhance treatment, improve profits, develop the team and keep you abreast of all that is dentistry. Dental TV's core product is the Verifiable Dental Video Collection, providing a minimum of 15 verifiable hours across 5 releases each year. These compilations of top quality programs are managed by individuals with experience in day-to-day dentistry, expertise in dental journalism and skills in broadcast television production. Every video release contains up to 5 programs that last between 30 minutes and an hour. An easy-to-follow menu helps you navigate your way through each edition, enabling you to watch what you want, when you want.
These days, the consumer has more choice of what, where and when to buy than probably at any other time in the past, and nowhere more so than here in the High Street. But how much do you know about competition law? Well, you better start learning, because following the Office of Fair Trading's recent investigation and report into private dentistry, you're going to need to know.
Well, the Manchester team have done a series of studies where they are looking at the value of restoring or filling primary teeth versus leaving them unfilled. And what they're arguing is that if dentists leave children's teeth unfilled, they tend not to flare up and give the children any trouble. However, we disagree with them completely, because the studies are based on a series of very loose experiments, and the sample on which they base their studies is in general dental practice.
Isn't that an amazing thing? Can you imagine if people were waiting outside your office just to come see you? You were a quote-unquote celebrity in your own right because people just wanted to see you, they wanted to experience you, they wanted to feel you. It's a mindset. It's a different philosophy. My job for today, for you, is to try and open your eyes and your ears to the possibilities. My job is to let you know that what you've been looking at all these years is a small part of the picture. There's an entire field out there, and you haven't seen it. You've only seen this way. You haven't seen that, that, or that. And if you don't see the entire picture, the patient has no way to understand that. They can't see the entire picture.
I think the other aspect of it was the possibility of Legionella within our water lines, and again, that was something that concerned me.
Others share Mike Walsh's concern that bacterial contamination of water is a potential risk.
We really don't know what the risk is, and the risk focus has always been on patients. Whilst obviously we have patients' welfare at heart, if we look at the problem logically, patients are actually only exposed to this water for actually quite a short period of time. Whereas the practitioner and his staff working in the surgery are actually working in this environment for prolonged periods. And so I think that perhaps the biggest risk is actually to the practice and the staff and not to the patient.
we try to have 1 or 2 of our existing dental clients in the room who are a year, 2 years, 3 years into the programme. And what will happen is that I will stand at the front of the room and I'll say, how would you like an idea that's going to improve your practice profits by 30% next year? And everybody puts their hand up and I'll say, okay, drop a day a week clinical. And there is this confused silence in the room where they all think I've gone mad. And then I will look round to my 2-year delegate and say, what did that sound like when you first heard me say it 2 years ago? And Malcolm will say, I just thought you were mad. And then I'll say, Malcolm, what happened? And Malcolm will say, well, in desperation, I tried it. And to my utter astonishment and amazement, we dropped a day clinical and the profits went up by 30%. And often they'll say, and we still don't quite know how or why, but it happened.
So Philip, you're going to tell us today about the new iBond and also the new Venus composite.
These are new products from Heraeus Culture. The iBond is a 7th generation bonding agent which negates the use of any etching beforehand, conditioning or priming. It's all contained in the one bottle. It comes either as a bulk bottle or single-use containers, which we use today. Simply snapped off the top. We apply 3 coats to the prepared tooth and we leave those on for 30 seconds. It's important to leave it for 30 seconds for it to penetrate and to provide a layer first.
But this is just a one-stage procedure?
No other etching to that.
So far, is this a cultural thing as well?
Yes, it is very much a cultural thing. I mean, an increasing number of dental graduates are Asian females. And although they've broken one barrier in the sense that they've actually gone to university and been allowed to do dentistry, immediately that is concluded, that phase in their life, the next thing that most of the families want is the females in particular to come back and stay at home. And so that actually influences the choices that they make.
So, how does it work and how is it verifiable? Every video release comes with multiple choice questions for each programme. Simply watch the programme, answer the questions at the end. This ensures that learning is taking place, and then submit your answers to Dental TV for verification. This can be done by post, fax, email, or via the website. Dental TV will then issue certificates and log all of the video education that you have participated in. So, what about costs? Well, there are 3 options. Option 1 is for your business to subscribe to the annual collection as a central training resource at a one-off price of £250 plus VAT. This gives you 3 copies of each of the 5 releases, in any combination, video, DVD or CD that you choose, enabling individuals to learn at times and in a format that suits them. If a member of the team then wants to verify some of the programmes watched, they are able to do so at an additional rate of £20 per verifiable hour. So, by your business using Dental TV as a central training resource, the whole team can benefit, and those wanting to verify their learning can pay as they go, on as much or as little as they wish. Option 2 is an annual personal subscription. For dentists and laboratory owners, this costs £250 plus VAT. For any other members of the dental team, the cost is £200 plus VAT. And for multiple subscriptions from one business, a graded discount structure is available. The costs of verification are included in all annual personal subscription options. And lastly, option 3, quite simply, is to purchase the individual releases that you want at £60 plus VAT. And again, the costs of verification are included. As with any other method of education, all these costs can be claimed as postgraduate allowances and classed as a business expense against tax. Whichever option suits you, simply contact Dental TV by telephone on 01494 890 296 with your credit card details for immediate dispatch of your first release. Alternatively, you can make contact through the